We begin our assessment today with the skin. As we assess the skin, we can see that it is pink, warm, and dry. Next, what we'll look for is the elasticity of the skin and any variations in color or skin turgor themselves. As you can see, the skin, it's pink, warm, and dry. There's good turgor with no decrease in elasticity. We will assess for any kind of abnormalities as far as tissue like keratin or a buildup of liver enzymes like jaundice. And as we look at the sclera of the eye, we can see that there's no jaundice. As far as abnormalities that we can see that there's some minor rosacea to the cheekbones, and then also just some minor acne along the hairline. Overall, the assessment of the skin would be normal. The last assessment we would check is for any moles, and if we have the patient look to the right, we can see that there's a cafe au lait spot, which we would check for mole A, B, C, D, E, E, and F, which would be whether it's asymmetrical, and in this case it is. We would look for the color, and the color is just a very light brown. We will look for the diameter, it's about 5 millimeters. We would look for the evolving, which the patient reports having it since childhood. We will look for any elevation, and as we can see, there's no elevation. And we would also look for any firmness or growth, and in this case, the firmness, and there's been no rapid growth. So overall, the skin assessment is good for this patient, as we can see the pink, warm, and dry skin. Next, we'll be assessing the hair, and as we assess the hair itself, the very first thing we will be checking for is any kind of abnormalities, such as alopecia, bald spots, or any kind of hair growth that is abnormal. As we look at the patient's eyebrows, we can see that they're symmetrical with good hair throughout, no obvious dryness or flaking. And as we assess the scalp itself, we are going to look for the health of the scalp. In this case, we can see that there's no obvious noted lesions, growths, any kind of dryness or flakes noted. We will also check for the fullness of the hair itself, and as we can see, the hair itself is full, very thick and shiny. So the growth of this hair has been healthy. We will assess the split ends, and in this case, there's very minor split ends, and in that case, we can suggest the patient either get a haircut or check for any kind of abnormalities with the hair follicles themselves. But overall, as you can see, that this patient's hair is well appropriated with good thickness, fullness, and generalized good health. Next, we will go ahead and look at the nails. And as we assess the nails, the very first thing we look for is their color. And in this case, their color is pink, not white or blue, which would be cyanotic. We will check the nails themselves for capillary refill, and we can see a brisk capillary refill with a proper refill within 2 to 3 seconds. We will assess the angle of the nail itself for any kind of clubbing, and in this case we can see a proper angle of approximately 160 degrees. We will look for abnormalities within the nail lines themselves, such as any kind of clubbing, which we do not see, any kind of white spots. We will look for Mies lines, which is transverse linear bands that would be right about there. Or we would look for any kind of linear bands or pitting, and there's no linear bands or pitting. The last, we will check for the Schirmroth point, and as we can see in the Schirmroth point, for it to be negative, there is going to be that diamond shape. If there was clubbing of the nail and the shapes matched up directly, that would be called a positive Schirmroth, and in this case she has a negative Schirmroth, as you can see that diamond shape that it should naturally cause. On assessment of the nails, we do notice that the patient admittingly bites the nails, and then there's a paranochi on certain nails, which is again a little slight infectious area that can be taken care of with either proper hygiene or antibiotics. Next, as we move to the assessment of the patient, we're going to assess the head of the patient. And in this case, the very first thing we're going to look for is the symmetricalness of the head itself and the size and shape. And as we can see, her head is normiocephalic from interior. From a lateral view, we also can see that the head itself is well rounded. There's no malformations, contusions, or bumps. As we continue, we'll look at the posterior of the head, again for any lesions, posterior bumps, variations. And again, that it appears normal as we rotate the patient through. Lastly, we're going to go ahead and check the head for any kind of obvious head injuries. We will look at the eyes, and in her case, we can see the eyes are symmetrical. We'll do a visual acuity, and in this case, we can see that ocular movement and muscle movement is appropriate. On visual acuity, overall, her pupils are equal, reactive, responsive to light, and accommodating. Next, we will look at the nose. We can see that the nose itself is well symmetrical, that there's no drainage or rhinorrhea noted, or no irritation to the nasal flares. Last, we will look at the lip structure, and in this case, we can see that the lips are supple, pink, and pliable. There's no lesions or sores noted. As part of the head assessment, what we will do is we'll have the patient smile, and in this case, we can see good muscle movement and ocular movement. We will check for muscle for the bony structure and prominences for any kind of drop-off or any kind of malformality, and in this case, we do not see that. We will check the jaw itself for any kind of crepitus when opening, and we'll also have them open and close their mouth several times to feel for any kind of popping, clicking, or any signs of TMJ. As we assess the mouth itself, we're going to see that the tongue is pink, that there's no obvious dental cavities, and that the mucous membranes in the mouth themselves are nice and moist. All good signs of nutrition. As we go through the head, part of our history assessment for the patient itself will be if there was any kind of head injuries. And also when we assess the head, as we look at the temporal area, what we will look for is the temporal artery. And we also can auscultate over the temporal artery if we have a stethoscope, and we will be able to check the pulses of the temporal artery. Next, as we go, we're going to look at the neck. And as well, we look at the neck, what we're going to look for is a trachea that is midline, and in this case it is. We look for the muscle definition on both sides, the sternomuscular muscle, the trapeze muscle, the omoid muscle, and the posterior triangle. As we assess the neck itself, we're going to assess for the jugular, external jugulars, and also the carotid pulses, which would be placed about here. We assess the patient for the ability to swallow, so we'll ask them to swallow. And as you can see, there's no, the trachea stays midline, and the patient is able to swallow without any kind of issue. We will palpate with both hands on the sides of the neck for the carotid cartilage, the cricoid cartilage, and then we'll look for the tracheal rings. About the third or fourth tracheal ring, what we'll palpate for is we'll palpate for the thyroid. And in this case, when we palpate for the thyroid, we're going to palpate for symmetricalness, any kind of growth or lesions noted, and also any kind of abnormalities. We will check the sternal notch. And if we don't notice anything different with the sternal notch, what we'll do is we'll move on to the lymph nodes. Now, when we assess the lymph nodes, we need to be very specific in the order that we assess the lymph nodes themselves. We are first going to assess the periauricle, which is in front of the ear, which will tell us if there's any kind of inflammation or infection near the ear itself. Next, what we'll do is the posterior auricle, which is right behind the neck here. And again, there's two small. We will assess for the occipital, which is at the base of the skull, right about here. And again, you're palpating for any lesions, abnormalities, or inflammation. Next, we will be assessing for the tonsillary, and the tonsillary will be right in here underneath the tonsils. And again, when you palpate, make sure that you palpate with 2 fingers so that you're making sure to get the entire lymph node. The next lymph node would be the submandibular, which is right at about the mandibular angle, and you'll be able to feel a few. And again, this is you're going to be doing this simultaneously on both sides. The next is the submental, which is right at the tip of the jaw, right